Hello, my name is Trina Ganguly, and the date today is February 22nd, 2023. Today I'll be discussing my diseases of the cell final project, and it will be on a lysosomal storage disease called Gaucher disease. And so Gaucher disease is a rare genetic disorder, which means it is passed down from parents to children. When you have Gaucher disease, you're missing an enzyme that breaks down the fatty substances called lipids, and in specific, it is the glucocerebrosidase enzyme that is missing. And so what starts happening is the lipids start to build up in certain organs, such as your spleen and your liver. And this has been observed to cause further problems down the line for the rest of your body and your other organs. This causes these organs to enlarge and can affect their daily functions within the body. And the fatty substances also can build up in bone tissue, weakening the bone and increasing the risk of fractures. In specific, Gaucher disease is called a lipid storage disease, where abnormal amounts of lipids called glycosphingolipids are stored in special cells called reticuloendothelial cells. And overall, there are 3 types of Gaucher disease. However, they all cause similar symptoms in the organs and bones and are known as 3A, 3B, and 3C, or type 1, type 2, and type 3. And the 3 types aren't really differentiated between much, since they also overlap a lot between within their symptoms. Next, we'll get into the cellular basis of Gaucher disease. And so regarding the cellular basis of this disease, Gaucher disease is not caused by failures at cell cycle checkpoints, but it is caused by a mutation in the GBA gene. The mutation is caused by a deficiency in activity of the catabolic enzyme glucocerebrosidase, and the disease is linked to mutations in the gene, specifically GBA1, and this gene encodes glucocerebrosidase, which is also known as gene N370S. In specific, Gaucher disease is caused by low levels of glucocerebrosidase, which is also known as GCase. And Gaucher cells are normal scavenger cells called macrophages that become full of unprocessed glucocerebroside. And so in this image, we can observe the cellular pathway of Gaucher disease. We can see from the top left, the cellular debris is on the outside of the macrophage. Then the macrophage is seen swallowing that debris and forms a lysosome with the waste material within the cell, or the macrophage. And then in terms of Gaucher disease, the macrophage should be lacking the necessary enzyme it would need to break down the cellular waste. And so as a result, the waste remains and is unable to be broken down and used by the macrophage. However, in the case of normal activity, as seen in this image on the right, the lower right corner, the macrophage has the enzyme that is necessary for it to break down the waste material. And so when it is broken down, it is able to go down its normal macrophage functioning pathway. However, during Gaucher disease, it is unable to do so. And so in this disease, certain lipids are not degraded, and the result is a lysosomal storage disorder. Now we'll be getting into the etiology of Gaucher disease. Mutations in the GBA gene is what causes Gaucher disease. There are nearly 400 different mutations which have been documented, including missense and nonsense point mutations, splicing mutations, deletions and insertions, fusion genes, and examples of gene conversions. Mutations in the GBA gene have been observed to cause very low levels of glucocerebrosidase. And furthermore, mutations in the gene encoding the lysosomal enzyme acid B-glucosidase and acid beta glucosidase, which is the GBA gene, is responsible for Gaucher disease and represents the main genetic risk factor for developing Parkinson's disease. For Gaucher disease, the gene that is involved is glucocerebrosidase, which is also known as the GBA1 gene. This gene comprises of 11 exons, 10 introns, and it spans about 7.6 kb of sequence. It is also located on chromosome 1q21. And this disease is a single gene disorder. It is not sex-linked. Both parents have to carry the recessive gene for it to be able to be passed on to the next generation. In addition, when it comes to checking for this disease, healthcare providers diagnose Gaucher disease using a blood test that checks for the enzyme levels. And so to determine if you're a carrier for Gaucher disease, your provider would usually your provider would usually do a DNA test using your saliva or blood. And specific doctors use a standard blood test called a beta-glucosidase leukocyte test, which is also known as the BGL test, to check for enzyme activity and see if they can diagnose Gaucher disease. If the test shows that there is low enzyme activity, then that would be suggested that the patient might have Gaucher disease. And since Gaucher disease is very rare, it is often observed that a specialist such as a hematologist, which is a doctor who specializes in blood-related diseases, or an orthopedist, which is a doctor who specializes in bone-related diseases, makes this kind of a diagnosis. And so in this image, we can see the mitochondria is bursting open and causing cellular waste and debris to come out of the mitochondria and out of the cell. And when it goes out of the cell, then that is when the lysosome envelops whatever debris comes out. And if it has the enzyme to break down that cellular waste, then it is able to go down further with the normal cellular functions. However, if it is unable to break down the waste in the situation where the enzyme is not working properly, or is not really there, it's missing, then that is when the lysosomal storage disorder comes into place. And so now I'll be getting into the changes of this disease at the cellular level. And so the sequence of the gene is known. However, there are over 300 types of deletions, insertions, and various other types of mutations. And so further research needs to be done regarding the sequence of the gene and the different types of mutations that are there. Mutation 370S, which is now known as N409S, is the most common genetic mutation associated with type 1 Gaucher disease. The mutation appears to protect against neurological involvement. Also, mutation L444P, which is also known as L444P or L483P as it is known now, is the most common mutation associated with type 3 or 3A Gaucher disease. And type 1 is also known as, type 1 is known as 3A Gaucher disease or 3A, and type 3 is N3C Gaucher disease. And so this mutation generally causes organ and bone problems first, and then later on causing neurological symptoms. And among all the mutations, the N370S and the L444P gene mutations are known to be the two most common mutations worldwide. Furthermore, this disease is caused by protein misfolding. When you have mutations in the GBA gene, oftentimes the GK protein is misfolded and never even gets to the lysosome. In Gaucher disease, people don't have enough of the GCase enzyme, and this causes the lipids to accumulate. And so as a result, lysosomes don't function as well as they should. And when the enzyme isn't made, this causes the lipids to be building up in different areas of the body. And the lipids are observed to be blocking other things, which contributes to the dysfunction of the lysosomes. Most of the GBA1 gene mutations that are responsible for Gaucher disease change single protein building blocks, which are also known as the amino acids in the beta-glucocerebrosidase enzyme, and it ends up altering the structure of the enzyme and preventing it from working normally. Other mutations delete or insert genetic material in the GBA gene or lead to the production of an abnormally short and non-functional version of the enzyme. And so as a result, this mutation is known to significantly reduce or eliminate the activity of beta-glucocerebrosidase in cells and causes glucocerebroside to not be broken down properly. And so in this image, we can see when a lysosome comes through the cell, comes out. In the normal instance, it has alpha-synuclein degradation within the lysosome. However, in the case of Gaucher disease, there is a lot of alpha-synuclein oligomers, which causes the lysosomal storage disorder through down the pathway.